Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Unfortunately, due to a technical error, sign language interpretation is not available today. Our apologies for the inconvenience. Malheureusement, en raison de problèmes techniques,
Because of a technical issue, we don't have sign language interpreters.
Disponible pour répondre aux questions des médias, nous accueillons in Council Chambers, Mayor le Maire Jim Watson, Steve Kanalakos, City Manager, Directeur Municipal, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we have Councillor Keith Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, Président du Conseil de santé d'Ottawa, la docteure Vera Etches, Medical Officer of Health, médecin-chef en santé publique, Dan Chénier, General Manager, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, Wendy Stephenson, Chief Financial Officer, Chef des finances, and Don Herwire, Director, Economic Development and Long Range Planning, Directeur, Développement économique et planification à long terme. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque...
By alphabetical order, I invite each agency to ask their question.
Reason we lose you during the call, please try phoning in again or contact Media Relations for help. So we will now start with Kate Porter at CBC Ottawa.
Thank you. Hi, everybody. My questions are for Mayor Watson. Mayor, could you describe, when Councillor Tierney came to tell you that he was the source of the confidential memo, passing to the citizen, and just your thoughts on it, given that Council and yourself had been quite adamant about getting to the bottom of things?
Yeah, thank you very much, Kate. My office was informed on Monday, and Councillor Tierney spoke with a member of my staff, and then he also spoke to the clerk. And obviously, what we were very concerned, 2 weeks ago, and that's why I supported the resolution that we asked the Integrity Commissioner to look into this. Councillor Tierney is remorseful. He's admitted he made a mistake and an error, and he's apologized, and that was accepted today by Council. Thank you.
And my second question is related to COVID restrictions. And given the accelerated reopening in Ottawa and the Outaouais, what are your expectations about border restrictions? Do you think they should be lifted sooner than the expected expiry date of June 16th?
The short answer is yes. I think I don't think they should have been put in place in the first place. It takes a lot of resources away from our police service, and as you know, now that it's not 24 hours a day, 7 days a week, people can go back and forth. And I think given the fact that we're going to be opening up our patios and capacity at retail stores and other freedoms, that it just doesn't make any sense to have that artificial boundary blocked on both sides. So my hope is that the Premier of Ontario will recognize that we're one economic union. Our buses go back and forth freely, as do workers who work in the large government complexes at Place de Portage and Terrasse de la Chaudière. And folks, I think the last I heard there were about 6,000 healthcare workers in the Outaouais that come and work in long-term care homes, hospitals here in Ontario. So the sooner they can lift those up, the less expensive it is for the province, because we're sending them the bill, of course, for our police overtime costs. And I think it would be the responsible thing to see those borders opened up sooner than later. Thank you.
Thank you.
Thank you very much. Up next, we have Eric O'Brien at City News Ottawa.
Hi, my question is for Mayor Watson. Mr. Mayor, I just want to ask you about the letter you sent to the Premier earlier this week about the 40,000 vaccines that you want to help here in the city. Have you heard anything back, and if so, what have you heard?
Yeah, thanks, Craig. Excuse me. No, I haven't. In fairness, the letter was sent I believe on Monday. And of course, the Premier was in London yesterday at the memorial service for the victims of the attack. So I hope sometime later this week or early next week, but they certainly have heard very clearly from me and other MPPs of our concern that we need to ensure that if they're going to lower us down another notch to 60 plus in age, they've got to give us a corresponding increase in doses. It just is simple mathematics, and we're not asking for more than our fair share, we're just asking for our fair share. Thank you.
My second question, maybe more for Mr. DeMonte. Is there a plan moving forward? Like, let's say if the Premier comes back and Ottawa will not be getting any additional doses, is there a plan to start alleviating the vaccine appointments in the city?
So since the beginning, we've always said when we have confirmed doses that arrive, that's what we plan for. And just related to Monday, 45,000 booking transactions were done on the provincial system, and we currently have over 200,000 appointments booked in our community clinics between June 1st and July 6th. So that's vaccine we know we get. So if we get more, we'll add more to the system. And if we don't get any more, well, we've already got those 200,000. So I guess what I'm saying is we never plan for hypothetical deliveries. We only plan when we know we have confirmed deliveries, and that's really important, as we've said since the beginning, because when somebody gets a booking appointment, they know when they show up at the clinic, there'll be a vaccine waiting for them.
Thank you.
Thank you, Eric. We will now be going to Ted Raymond at CTV Ottawa.
Hi there. This question is for Mayor Watson, and I'm hoping that perhaps Dr. Etches can weigh in on this as well, given the case counts that we've been seeing lately, including the very low count today in the past few days. Are you concerned that the province's reopening plan is, at this point, too slow for Ottawa? And have you had any conversations with provincial officials about that, including regional reopening strategies, especially given how things are moving across the river in Gatineau?
Yeah, maybe I'll start and ask Dr. Etches to comment further. I guess I'm happy on two fronts with the provincial decision to open us up 3 days earlier than was planned, which is good news for this weekend. And secondly, that they gave enough advance notice. They announced this on Monday, so as you know, restaurants in particular have to pre-order food and get their staff all lined up and so on. So, in the last time we went through this shutdown, it was 24 hours notice. This time it was 4 days notice. So I know I've heard from the restaurant industry that's much appreciated. I think I've always been of the view that we should have a regional approach based on how well we're doing or how well another region is doing. We, in essence, for all intents and purposes, do have a regional approach now. There's a couple health units in Northern Ontario that are not going into stage 1. So that's been done based on the high counts in the South Porcupine area near Timmins. So I continue to argue that point, but to date, the province has tried their best to have one size fits all, but they have made exceptions, as we pointed out just as I pointed out in the last sentence with respect to the Porcupine unit. And my view is that if we start to see our numbers go in the wrong direction, then obviously the province may use their emergency brake and shut it down. So we have a collective self-interest to make sure that this weekend we open our patios and open the stores, and we do so with caution and being responsible, so that we don't lose that freedom that we work so hard to get to have a meal on a patio or to go into a store and shop in person, which people haven't been able to do for a long time. Dr. Etches?
Yes, thank you. I support the province's approach to opening cautiously with time to monitor what's happening with the COVID levels in between steps. The numbers we see today represent activity that happened 2 weeks ago, and what happens on Friday, we won't see the results until 2 weeks after that. So we do need to go carefully because we still have COVID in the community at a level actually that's not very different from when we reopened in February, and we saw the quick exponential growth that happened then. This level is 10 times higher than it was at the beginning of last summer. And we know that there are variants of concern at play. So we're very fortunate that we have immunization helping us here. That is a good difference. But we see the Delta variant is growing in prevalence in Peel and in other areas. And now, the rest of Ontario is also showing more of the COVID is made up of the Delta variant. So we need time to monitor the impact of the changes and focus on what we can do, choose those lower risk activities outside, groups of 10 or, smaller is better, outdoors. If you're with people from outside your household, it doesn't hurt to keep distance. The other thing, that I think is important to recognize is we still have outbreaks in long-term care homes, outbreaks in hospitals, outbreaks in workplaces. There is community transmission of COVID-19. So we want to proceed carefully and choose the lower risk, measure the progress.
All right, thank you very much. I guess my second question will be for Mr. DeMonte and Mayor Watson, if you'd like to weigh in on this as well. In terms of getting those second shots to seniors, there has been a lot of frustration with regard to the provincial system. I know that's not entirely in your control, but also just in terms of the availability in the last little while, what is the city doing to kind of help alleviate that frustration and really get those needles into arms for people who are desperate to get that full immunization?
So, you've clearly indicated, unfortunately, the provincial booking system is that. It's the province, and they had, again, some challenges Monday. So what are we doing to alleviate? There were 17,000 seniors that were at risk of not having their second dose, and we didn't want to risk that. So over the weekend, our staff and public health called those 17,000 individuals to ensure that we were able to rebook and guarantee them a vaccine. So we took care of that as a first problem. And as you can see, it's just a hierarchy of trying to resolve issues and what's most important. So we took care of those. With regards to the frustration, I think the mayor's been, his description's been probably the best I've been able to do. It is complex, but at the end of the day, you can't keep lowering and adding people that are eligible without having a corresponding increase in vaccine. And that has been the challenge in very simple terms. And so every single dose of vaccine that we have available, we put on the system that we know we're going to have. And as I indicated earlier, we currently have over 200,000 appointments booked from now till July 6th. So that's vaccine that'll be being put in arms of older individuals, but also all the other groups now that are on the booking system. I think you'll start seeing, you see our data today, 70% have got their first dose, 18 and over, and somewhere 8% second dose. You're going to start seeing the second doses increase because in those 200,000 appointments, a good majority of those now are second doses. So we're starting to shift in the community. However, there's still a lot of first doses that need to be done. And so at the end of the day, if we get vaccine, it'll be on the system. There's little we can do to create more vaccine other than getting it from the province, and that would be the solution to ensuring that everybody in all these groups would be able to get an appointment.
If I could just offer another comment. Look, today we had some really good news with one case and close to over 70% of the population who have been inoculated with one shot. But let us not go out and celebrate too soon, because we've seen this virus. It can whiplash back and hurt a lot of our fellow citizens. So, while we celebrate today some good numbers and the great work that our staff are doing at the vaccination centres, our nurses from Ottawa Public Health, the paramedics and others, we have to constantly be on guard against this virus because we don't know what the numbers are going to be tomorrow or the next day. So I urge people to please go out and conduct your activities starting this Friday and this weekend. Have fun, but please be responsible and prudent. Alors certainement pour moi c'est important de.
For me, it is very important to celebrate the good results. We only have one case today in Ottawa, and more than 70% of the Ottawa population has received its first jab. At the same time, it's important to respect public health measures because the COVID-19 virus is still present and still very dangerous for the population.
Thank you very much. We will now be going to Craig Lord at Global Ottawa.
Thank you. This would be for Dr. Etches. I'm just curious from OPH's contact tracers perspective, have we seen a reining in of the social behaviors, the private gatherings or carpooling to work that were being talked about as sources of spread? Have we seen those being reined in the past couple weeks? And as things start to open up on Friday, are you worried any of those social behaviors will begin to lapse?
Thank you for your question. We definitely still see the main pattern of the majority of people who test positive have someone in their circle of close contacts who has been positive. And so first and foremost within the household, but then yes, in social groups, carpooling actually still continues to happen and cause a potential risk for transmission. And then we see the outbreaks in workplaces. It has diminished, and then the ongoing workplaces in hospitals and long-term care. So the quantity of COVID-19 has come down very nicely thanks to everyone's hard work, and so fewer workplaces are now affected. As places open up, we're reminding businesses to use the good COVID control measures that they have learned to decrease that risk of transmission in workplaces again. And, I think it is important for everyone to understand we are aiming to keep up these distancing and masking measures until we see that the population is well protected with the vaccine. And, fully protected is 2 doses. We think everyone who wants 2 doses, the vast majority are going to have that by the end of the summer. We're getting towards a place where we'll be able to reconsider some of these things. But for now, we want it to proceed carefully. We want to measure the impact of the lessening of the restrictions. And so with the case management, I also wanted to give you the update is the team is able, to follow up on everyone who tests positive and their contacts. So we'll be looking for any changes in the pattern of transmission and letting the public know.
Thank you. And you kind of touched on, I think, my second question, but maybe this is also for Anthony DeMonte. We're at 70% first doses now. Based on the current momentum that we have, the current rates of vaccination and the supply that we've gotten to date, barring any potential increases, at what point do you think we could make 2 doses available for, say, 70% of the population? Is that going to come sometime in August or sooner or into September, do you think?
You're asking me to kind of make a projection based on what I would tell you is I would refer you back to the phased opening. So the next phase we have to be 70% of the population 1 dose and 20% second dose, and we're starting phase 1 on Friday, and then 21 days later we have to hit those targets. I'm pretty confident with the number of appointments that have been booked by the general population that we'll be able to at least meet those targets for phase 2, and we'll be ready if the province okays phase 2 in 21 days after Friday. So I think that's the good news. To tell you 70% of the population the second dose, that's a little far out to make those predictions right now. We haven't really kind of looked at that.
And I made my comment based on the biggest picture, which is what we know the expected allocations are arriving from the federal government to the province. So there is the expectation that the 2 doses will be able to be completed for most people who want them, by September.
Thank you.
Thank you very much. Nous allons maintenant passer à Julie.
Let's give the floor now to Julien Paquette from Le Droit. Go ahead. Hello, everyone. My first question is for Dr. Etches. Clarification question. So we have the dashboard on the website, the Ottawa Public Health website. Unless there's a mistake, we said that there's less than 1 case. So is it 1 case less than previously? Can you explain why we have -1 case on the dashboard? Are you subtracting 1 case? No, it's not a mistake. It's a report that we have after we are collecting data of all of the active cases. So what you see on the dashboard is the actual data. So sometimes what happens is that the person lives in we're using the postal code of the address of that person. So it's a person that was tested positive. It was within our database. But actually that person is part of another public health unit. It's from another region within the province of Ontario. So it's not a mistake, but that's the reason why you see -1 case. So it was a change within our database. Does this answer your question? Yeah, I wanted to understand well. So it's someone that has a positive test, and then afterwards you saw it. So is it because the person was tested in Ottawa but lived actually elsewhere? It's not always because a person moved out of the city of Ottawa. It's just a mistake that was corrected in their home address. So do you need more information in French? Yes, I would like to receive it. Thank you, if you have some more explanation in French. My second question. Sorry, I would like to add on. To understand the situation within the city of Ottawa, we have to use the average on 7 days. This is why you see on the website that we're using an average over 7 days. So we're having an average over the past 7 days. So this is how we see the changes. So we're not reaching a 0 yet. 0 positive tests yet. Follow-up question for Mayor Watson. You were talking about Councillor Tierney's excuses. I'm trying to better understand. You requested an inquiry. The commissioner was able to proceed, identified who was responsible. Will there be any consequences? If you have an inquiry and there are no consequences, why did you proceed with the inquiries? How do we say purpose? The objective? L'objectif. The objective, I mean the purpose of El Chantery motion about 2 weeks ago was to be very clear. We have to respect the code of conduct, the code of ethics at the City Council. So when we have so the objective actually of this motion is to make sure that every single member of the City Council do respect the rules in place. Councillor Tierney presented his apologies, and for me, that's the end of that file. That's the closure of that file. Thank you so much.
To John Willing at the Ottawa Citizen.
Thanks, Kina. Mayor, I'll ask my questions through you. I'm wondering about the discussion about the new warehouse in Gloucester, South Nepean, and I'm wondering if the new official plan is taking into account this new demand for warehousing in Ottawa, and can residents expect more of these developments to happen away from major highways in Ottawa?
Yeah, I think, John, the issue with that particular site is that it was set up many decades ago by the former city of Nepean with an intention of attracting big businesses to locate on that site. That's why it's called an industrial or a business park. And so I think the application that came forward, notwithstanding the fact that there was a large number of people in the vicinity who didn't support it, it was a recognition that our economy, particularly in the midst of COVID and post-COVID, changed dramatically, and there is a need for more of these larger facilities, as we're seeing in Carlsbad Springs and Barrhaven, and at this particular park. More and more people are shopping online, whether we like it or not. That's certainly the trend. You just go by any one street on garbage and recycling day, and you see the number of boxes from companies like Amazon and Canada Post. So I recognize that people don't want to see those large facilities, but unfortunately, staff recommendation was that it meets the criteria, and the routes that the trucks will have to follow are already designated truck routes. Thank you.
Thanks, Mayor. To follow up a pandemic-related question, I'm wondering what's the city's current thinking right now on outdoor event permits for the summer? I don't know if that's for you, Mayor, or Mr. DeMonte.
Yeah, I'll ask Tony to comment. Obviously, as we head towards the next stage 2, it opens up a little bit more of the freedoms. I certainly would like us to start seeing some of the smaller scale activities taking place in the late summer, early fall. I know, for instance, that rural fairs, I believe, are on, I'm not sure if it's stage 2, Tony, I think, that would allow our rural fairs to open up this fall, which would be great for the rural economy. So obviously, I'm very bullish on getting some of these special events and facilities opened up sooner than later. We have to do it in consultation with Dr. Etches, and ultimately the province has to make that decision. But we saw a glimmer of hope when they announced stage 1 is going to open a few days earlier, and they gave us more notice than they had in the past, which is good. So Tony, on
the only thing I'd add, John, to that, as the mayor says, we're going to follow the provincial orders, and as he indicates, it's the province that's going to dictate that. But what we've done here is our special events team, in collaboration with Dr. Etches and Public Health, are stood up and ready, and we're mobilized. So as this evolves and people can bring it, we'll be able to process this really quick and support them, understanding the rules and how they have to be set up, and making sure everything is with regards to the regulations, so we can have these events when they will be permitted. So I guess it's just we're mobilized and ready to be able to support that.
Thank you both.
Thank you, John. We will now be going to Taylor Blewett at the Ottawa Sun.
Thanks so much. My first question is for Dr. Etches. I'm wondering, are there any groups you would like to see prioritized for a second dose as early as possible? I know the science table came up with a report yesterday saying certain people with disabilities, for instance, should be prioritized for early second doses among those now eligible to rebook expedited second doses.
Thank you. Our focus, obviously, is still to make sure that as many people as possible get their first dose, because you need that before you can get your second dose. And when it comes to first doses, we're seeing we need to make sure that youth are able to access vaccine. That is a priority. They have the lowest coverage rates right now. And then we're also working hard with different neighborhood partners to make sure that we can increase coverage rates where neighborhoods may have residents who have more barriers to accessing the systems for immunization. And so when it comes to second doses, I support the provincial approach, which is to focus on older adults. We know people over 80 and people over 70 could benefit from the second dose. And you're right, there are some health conditions where it makes sense to get a second dose in sooner rather than later. And so if the science table has new information, I'm sure that will inform the provincial approach as well.
Thanks so much. And I'm not sure if this would be for Dr. Etches or Mr. DeMonte or both, but to your knowledge, has securing a second dose 12 weeks after their first been a problem for people in Ottawa who received AstraZeneca for their first dose? And if so, has OPH or the city been doing anything to make sure those people can get a shot of their choice, whether it's the mRNA or a second AstraZeneca dose at the 12-week mark?
So I apologize. I don't know. Dr. Etches isn't responding. I had trouble hearing you. If you could repeat your question, please.
Oh, I'm so sorry about that. Okay. Can you hear me okay now?
Yeah.
Is that any better?
Yes, thank you.
All right. For sure. To your knowledge, has securing a second dose 12 weeks after their first been a problem for people in Ottawa who received AstraZeneca for their first dose? And if so, has OPH or the city been doing anything to make sure these people can get a shot of their choice, whether it's mRNA or second of AstraZeneca, at that recommended 12-week mark?
So currently, if someone received a first dose of AstraZeneca in a pharmacy, they're encouraged to go back to that pharmacy, and I'll let Dr. Etches talk about the consent and the science behind it. But they have the option to receive a second dose of AstraZeneca or an mRNA vaccine as an alternative. So that's the first process. I can tell you that the province has indicated that they're flowing more vaccine to the pharmacy, to the pharmacies in general over the next few weeks. So I think that'll give that opportunity for people. At the beginning, there were some people that traveled outside of Ottawa to go to the first pharmacies that were providing AstraZeneca outside of Ottawa. So there is a bit of a challenge for them, and they're in that time frame that you're discussing. But my understanding is many of them are able to secure a vaccine. There may be some exceptions, but they have to again go back to the original pharmacy to get that, and then they'll proceed. And I don't know if Dr. Etches wants to add a little bit on the advantages or the disadvantages of using mRNA or a mix of both.
No, Tony, you're right. The choice is the person who had the first dose of AstraZeneca, and if it was a pharmacy provider or a primary care provider, they are going to provide that informed choice to their patients.
Thank you very much. Merci beaucoup. Nous allons maintenant passer à Emmanuel.
We will now give the floor to Emmanuel Plasson from Radio Canada. My first question is either for Mayor Watson or Dr. Etches. Yesterday, Quebec authorized graduation balls outside. In Ottawa, we know that some school councils said that it will not have any balls. So you think that the youth will cross the border to celebrate in Quebec because we know that the border will reopen next Wednesday? I would like to say, first of all, congratulations. You have your diploma. And thank you so much for the good work, because we were able to limit the transmission of COVID-19 throughout the school year. Thank you so much. So I know that the student had less contacts with other students. But right now in Ontario, we only allowed groups of up to 10 people. It's limited at 10 because we continue to have COVID transmission within the younger population. So we want to vaccinate. I know that the population in Gatineau, the youngers were vaccinated. We are now offering a first dose to the younger population here in Ottawa. So right now we know that youngers are not as affected when they catch COVID-19. But the transmission is still there. Then this can be transmitted to the other members of the household and outside of the household. That's the reason why I would like to ask, if possible, during the summer, so I think that after the summer, our population will be better protected. Then there will be more option to celebrate graduation. Thank you so much. Follow-up question. What will you do to encourage people not to cross the border? Are you going to work with the schools within Ottawa? Will you ask their help? What kind of actions will you put in place to prevent cross-border? Because you know we have very big parties after the graduation ceremony. I will need to discuss this question with my team. We haven't started talking to schools for right now, but I think that working together, we'll have to keep on sending the same message. We have to protect our community. But we know that pretty soon we will be able to cross the border, but right now it's possibly not the best idea.
From On the City from the Burbs.
Thanks very much. Mayor Watson, there's probably no one in this city who more of the city than you do. Everyone knows you're out there constantly. Obviously, I think the racist attack in London took us all. It was very hard. Do you see elements of this in the city?
Yeah, Sue, unfortunately, yes. Not as much in the last year and a half because so many people have been restrained and staying in their homes and not doing a lot of traveling. So I haven't had as much contact, obviously, with people. But you hear snide comments if you're walking by someone. Anti-Semitic, Islamophobic, homophobic. Words. So, we're not immune, unfortunately. We've said this before, but we're not immune to this kind of hatred in our own city. We've seen it over the years when Rabbi Bulka's synagogue was spray painted and Reverend Bailey's church in Parkdale was spray painted, and Imam Sami's mosque was attacked. And so, the tragedy that took place in London, we sometimes are a little smug as Canadians thinking these things happen elsewhere. We see them on the television screens a world away, but unfortunately there are, a number of people in our every community in this country that are hateful individuals that just, can't seem to accept that we are very much a multicultural society and community, and that's what I think makes Ottawa and Canada such special places to live in. And we're seeing the grief of the nation where this family of 5 people were just out taking a Sunday night stroll, and 4 of them killed instantaneously. And I think of that poor young boy, whether he even has been told that his parents have been murdered. So we have a lot of work to do as a society and as a people. Thank you.
I appreciate that. It's hard to believe. And the other question, not nearly as heartwarming, Tim Tierney's revelation that he claims to have inadvertently leaked the memo is, when did you hear about it and what happens now?
Yeah, heard about it on Monday, and then also again on Tuesday from the clerk. And they worked out a path forward, which was announced today with his apology, and Council asking the Integrity Commissioner to cease the investigation given the fact that the individual has come forward. Thank you.
But is there going to be any punishment for him?
As you know, the punishment would have come from an Integrity Commissioner's report, and if the Integrity Commissioner chooses not to pursue it because the individual was identified, namely Councillor Tierney, then we can't on our own dole out punishment unless it comes as a recommendation from the Integrity Commissioner.
Appreciate that. Thanks.
Thanks.
Thank you very much, everyone. Merci à tous pour votre temps.
Thank you very much, everyone.
Bonne journée.